Hi, I'm Paris, and for nearly a year now I've been trying to get permission to do hyperbaric oxygen treatment to treat radiation proctitis that developed about a year and a half after having radiation treatment for prostate cancer. It's been a long and winding road, nearly as long and winding as the colonoscopy that I needed to have yesterday in order to document the radiation proctitis in the rectum so I can try to get my hyperbaric oxygen treatment approved finally. Now, I did a video last year after developing radiation proctitis, and I've had a number of people ask me in the comments on that video to do a follow-up because other people are suffering with this. They'd like to know what's worked, hasn't worked. For me, well, pretty much everything I've tried hasn't worked, and I've gone through everything that my doctor recommended, changing out the diet, avoiding any strenuous exercise for an extended period, stopped my supplements, my vitamins. When that didn't work, went on to steroid suppositories that made me feel weird because I think the steroids were getting absorbed up into my body. I did everything that was asked of me, but I wasn't seeing any relief from the rectal bleeding, which is how the radiation proctitis often presents itself. The prostate and the rectum are awfully close together, and so if you get some of that radiation into the rectum, it damages the rectum wall, and for whatever reason, at a later date, that turns into an ulcerated wound that bleeds, and it just won't heal. And when the steps recommended to me by the place where I received my proton therapy radiation didn't work, I researched a treatment called Hyperbaric Oxygen Therapy, where they put you in a pressurized container, have you breathe high dose or even 100% oxygen for like 90 minutes at a time. You do this 5 days a week for some weeks. That infuses the oxygen deep into your tissues and can allow hard to heal wounds to actually heal. Not invasive, no chemicals. I asked my radiation oncologist if he could prescribe the hyperbaric oxygen treatment, but he sort of poo-pooed the idea, yeah, pun intended, and had me double down on the steroids, doing more steroid suppositories for a longer period of time, and they were already making me feel really unwell. And he said, if that doesn't work, we can send you for this treatment that involves putting argon gas into the rectum and using a laser to ignite it, and that cauterizes the inside, so that'll take care of the bleeding. But I do not need explosive internal combustion happening in my rectum. Not long after that visit with my radiation oncologist, my father's health started to go downhill, happened fairly rapidly, and he passed away a few months later. And after taking care of all the final arrangements, I'm the trustee of his trust, and that has proven to be so much more stressful than I would ever have imagined. But in other words, I've been dealing with a lot of other things, so I did not have time to deal with this situation until earlier this year. I had a visit with my medical oncologist to see how I was doing now that they've taken me off of Lupron and my testosterone's coming back up. I mentioned about the radiation proctitis and that it had been at that point like 9 months or so, and that I had tried everything my radiation oncologist had suggested to help with this, and his suggestion was that I get the rectum filled with the argon gas and ignite it with a laser. Do not try this at home. And she said, well, that doesn't sound very pleasant. She said, what works for a lot of people is hyperbaric oxygen therapy. And I said, really? Maybe I could try that. So she wrote up the order for me to go to a wound care center at a hospital here in Austin where they have the hyperbaric chamber. And so, yay, I'm finally going to get a chance to do this, but not so fast. So when I went to my initial appointment at the wound care center, they wanted to make sure I'm a good candidate for hyperbaric oxygen because you are under a couple atmospheres of pressure. You may have medical conditions that mean you can't do that, but I checked out, everything was going to be good, and they said, okay, now about your radiation proctitis diagnosis, do you have the documentation for that? And I said, well, when I started having the bleeding, I contacted my radiation oncologist, and they said, yep, you have the radiation proctitis, and to do these things, and it didn't help. And they said, you have a probable diagnosis, but you don't have a definitive diagnosis, and we can't bring you in to do the treatment without a definitive diagnosis. And I said, okay, what's that involve? And they said, well, somebody's got to go up in the rectum there and look and see, and if they can identify it as radiation proctitis, then we should be able to do that treatment for you. So, okay, so you've got to make an appointment with your gastroenterologist. So, had to wait a while to get that appointment. And the doctor there said, sure, we can go in there and take a look. It's called doing a colonoscopy. Now, I had been with the same doctor for a colonoscopy 3.5 years ago, which they found a couple little polyps and snipped them out. But I wasn't due back for another colonoscopy for 5 years. So this was moving up my colonoscopy 1.5 years. But I've been working so long to get the hyperbaric oxygen treatment. Fine, whatever it takes. So sign me up for a colonoscopy. And then the doctor mentioned, while we're in there, we could just go ahead and treat it with some argon gas and a laser. I said, oh, I didn't know that was done at the same place they do the colonoscopy. And they said, sure. I said, I don't want to have that done. I understand it's tempting because you're in there anyway. And I think I had sort of an exaggerated idea of that procedure. I think they actually just locally in part of the rectum use argon gas and a laser, and they cauterize the wound closed. They don't fill up your whole rectum with the argon gas. At least I don't think so now. Still, I had read that with that cauterization, you can have scarring, and then for some people it can lead to painful bowel movements in the future, because if you sort of imagine you've got this big scar in the rectum has to expand and contract when it fills up, and the pressure, and yeah, I did not like the idea of possibly the rest of my life having pain from that, even if it's a rare thing, because they're not really healing the wound. They're solving the problem. They'll stop the bleeding by cooking that bit of flesh, but how about let's just heal that bit of flesh and get it back to normal tissue as much as it can. And if that solves the problem, but it's still all flexible and stretchy like regular tissue is, that would be better for me. So I told her, tempting as your offer is, I would just like to have this definitive diagnosis, because I know they go with the camera and you can get pictures of what's in there. So some photographs of it, and then in the report, if it can say radiation proctitis was found, that should be enough to satisfy the wound care center so I can get this treatment that I want. So I was told, okay, I'm making a note right here to look for the radiation proctitis, but to not do the treatment for it. I was so sure that they were still going to go ahead and do it anyway when I went to the colonoscopy center. Everybody I saw, every nurse, the anesthesiologist, everybody, I said, by the way, you're going to find the radiation proctitis. I do not want that argon gas laser treatment. I had the colonoscopy done yesterday, and they discovered radiation proctitis. Since I'd had the colonoscopy 3.5 years back, I have some good 3.5 year photos of the rectum, and yesterday's look at the rectum. So when I came out of the anesthesia yesterday and the doctor came to see me, I said, you found the radiation proctitis? That's the diagnosis? He said, yes it is. And I said, and you didn't do anything with the lasers? He said, no, we didn't. So once I got back home, called up the wound care center and said, all right, I've got my diagnosis, and they've got all the documentation there. I got photos, whatever you want. So they're great. We'll contact them. We'll get all that moved over so we can get you scheduled. So yay. Except then, today I got a call from the wound care center. I think it's going to be to schedule the start of my hyperbaric oxygen treatment. But no, they did get all the results, and yes, it's radiation proctitis. But now they need to go and get all my records from my radiation oncologist. I just as soon leave him out of this, because he appears not to be much of a fan of the hyperbaric oxygen treatment. And I can say the different doctors I've talked to along the way, some people really seem like, yeah, that's a good idea. It doesn't have the downside and it helps a lot of people. And other medical professionals have been like, psst, just do something that we know is going to work, that it's hyperbaric oxygen. To them, it seems to me, the impression I get is that it's some hippie new age healing thing. Why don't you do the real medicine that works? That's the impression I've gotten. So now I'm a little bit worried that they're going to contact him and he's going to say, what? Hyperbaric oxygen? Psh, and cause some problem for me to finally get this treatment that I'm so close to being able to start, so I can finally heal up this open wound. Hopefully I will be doing a video in the near future telling about how the hyperbaric oxygen treatment actually is working, and at the conclusion of it, let you know the results that I've felt. Apparently, that treatment can work for lots of different inflammation type injuries that you have, including, I have read, arthritis, which I have had since starting the cancer treatment. And the worst, most recent one is in this thumb. And what I'm hoping is maybe I'll see some improvement in that, maybe that joint inside, because they found now that osteoarthritis is not, as they said for years, a wear and tear type of arthritis. No, it's inflammatory. So your immune system is involved. I know with rheumatoid arthritis, they know it's your immune system is involved, but in a more subtle, generally slower progressing way, the osteoarthritis is too, from what I've read. In any case, the hyperbaric oxygen, infusing the oxygen deep into the tissue, allowing healing, I'm really hoping is going to help with the arthritis here, the arthritis here, arthritis here, and in the hips and in my right knee. It's just the knee arthritis that's keeping me from getting out on the trails, and it's so frustrating and it's so slow in healing. So actually that would be a good test too, both how the thumb arthritis is doing and my right knee, to see if I can get back out on the trails after the hyperbaric oxygen treatment. That would make me a happy camper, happy to be camping again, and I'll see you on the next review.
There are so many choices and you don't want to stress. You want your health food at home, receiving only the best. That's what we're here for, we give honest reviews. Paris DX.